Welcome, everyone, to the American Rescue Plan Act Stabilization Funds, which is ARPA-S. This is the ARPA-S allowable uses and the final report. Today, you are a guest of the New Hampshire Department of Health and Human Services, and it's being hosted by our colleagues at Child Care Aware, New Hampshire. We have Lindsay and Dee Dee with us today, who are going to help manage questions and make sure that I don't make too big a mess out of this. So let's get started. The usual logistics. And oops, hold on. I'm having a little mouse issue. Here we go. Okay. So the usual, everyone is muted. You actually are muting yourself today, so we can all hear well. If you're having any difficulty, please email us at the CCRR training at southernnewhampshireservices.org. To ask questions or make comments, you can put it in the chat. Feel free, we'll go through any questions that are in the chat. So if you think of something as we're going along, feel free to pop it in there. And if you're participating by phone, you can always send it to that same email, ccrrtraining@snhs.org. To get professional development hours for today's webinar, all you need to do is type your full name and your program name in the chat, and we will make sure that you get those credited. If you're participating by phone, you can send your same thing, your name and your program name, and also include which webinar, since we've got so many of them going on, that you were attending, and we will make sure you get those professional development hours. So the PowerPoint, the FAQs that come out of the chat, the recording of the call are all going to be posted. And this is a new link for you. So it's, I don't know why it has the double HTTPSs, but it does. We have now migrated the COVID-related provider grant funds information. We've got rid of that messy page and moved it into the provider section. So you go, if you need to, if you forget where it is, go under the provider tab on newhampshireconnections.org, and you're going to look for the under state initiatives. You're going to look for that COVID related provider grant funds, and everything you need is right there. In addition to the fact that the final reports, the allowable uses, and the instructions are being emailed out to all of you.
Diane.
Yes.
Sorry to interrupt. Just in the Q&A, we do have two folks that said the chat is disabled. So do you want us to just pull questions out of the Q&A where they can post a question?
Sure. Because I'm not readily seeing a way to enable the chat without going back into the
and it's probably because it's in webinar format. So we can certainly take note of the questions that come in through the Q&A and do it that way for you.
Super. Okay.
Right.
So go ahead, anybody. And by the way, if you don't happen to put your name and your program in the Q&A, I've also got a list of who attended. So we're good there as well. All right. So let's jump back. So today, what we're going to do, first of all, welcome. It's Diane Chase. I'm the Assistant Bureau Chief of the Bureau of Child Development and Head Start Collaboration with DHHS. I think by now we all know each other pretty well. I've spent probably more time with you than anybody in the past almost 3 years. March 16th, it'll be 3 years that we've been doing this together. So let's talk about what our goals are for today. Today, my goal is to share with you information on the intent and use of the funds of the ARPA-S funds from the federal and the state perspective, and then what the guidelines and the timeline for the ARPA final report with regards to those allowable uses, how to track and document the use of the funds in the final report, and then how you can get some technical assistance and resources. Now, I do want to strongly emphasize that today is just a starting point. So don't feel like if you think of a question after you leave or you have another issue, this is not your one and only chance to ask questions. This webinar is going to be recorded, but also we have virtual office hours. And when we get to the end, I'll tell you where to find out the dates for those and how to sign up. So first of all, what was the intended use of the ARPA? And I left CASP in there in case you recognize the CASP term. As you know, I have a little thing about abbreviations. So I came up with another name for it, but none of you ever called it that. Everybody called it ARPA-S or ARPA Stabilization. So what was the purpose that the federal government wanted us to do? Well, we had, as you recall, this came out in the summer of 21. And it was really, the idea was to start to stabilize us. We had gone through somewhat of the worst of the really unstable times. We were looking towards the fall and kids returning to school. Vaccines had been introduced. People had started to return to work and all of those sort of things. So this was the next step after that CRRSA money. CRRSA was the first stab at stabilization, but still included the income losses and things like that. And this was the next step of helping us as a child care sector to stabilize, start to rebuild. And that means rebuild quality child care, addressing parents' needs, supporting the workforce. It was a huge program, and it was designed to address the financial burdens that were being faced by childcare providers across the country. Here in New Hampshire, we got around $47 million for the ARPA stabilization piece. And if you think about how tiny we are in relationship to some of the other larger population states, you can imagine how much money they had to manage. The exciting thing about the ARPA funds is that ARPA really had a lot of what I call wiggle room for how we could utilize the funds and how we could support our providers in the state. So some of the guidance that we in turn gave all of you based on the federal guidelines was right off the top, there was a minimum of 25% of the word, can't talk today, must be used for staff incentives. That's for round one only. So for those of you who had round two or even round three, you do not have to take that 25% off the top. So when you're doing your final report, if you got $100,000 in round one and you got $25,000 in round two, you do not have to take the 25% or set aside the 25% in that round two, only of your round one total amount. Now, what was the idea behind this? The idea was behind it because stabilizing the workforce was a key portion. And it's not that we thought that childcare providers wouldn't do that, but we wanted to give them an incentive. And also in larger organizations or owner but not director operated programs, sometimes there needs to be a motivation to make sure that the staff, the money trickles down to the staff. So we'll talk more about what that 25% meant as we go through, but the idea was that it would include wage increases, bonuses, things like that. And then the remaining funds had to be used for at least one of the following expenses. Now, I do want to emphasize, as you're planning how you're going to document what you spent your ARPA stabilization funds on, you can spend it all in one category, and that would be personnel costs. If you were going to do it all in one ball of wax, if you could get that 25% in their personnel costs, as well as pay for the rest of those, that is perfectly acceptable. Otherwise, you're going to do a personnel cost and then spread it in other areas accordingly. Now, what are some other ways that the funds could be used? Employee wages and incentives beyond the 25%, the operating and occupancy, materials, supplies, staff development, transportation improvements. The big thing to remember here, and as I'll keep saying this, it cannot be used for direct care services or income losses. So people say, well, but what about our income losses? Well, think of it this way, and this is the easiest way for me to describe it, is that it is meant to reimburse you for expenses that were incurred after the declaration of the public health emergency. And they use January 1st, 2020 as that point. Now, let me just reference for those of you who got both ARPA and CRRSA, CRRSA is different. CRRSA starts on March 1st, 2020, but ARPA starts January 1st, 2020. So a little bit different. CRRSA can be used for income losses. ARPA can only be used, the previous to the time when you actually receive the money can only be used for expenses. Some of the other things that you shouldn't forget as you work through this. Funding for facility improvements and minor renovations was permitted. And the example that they give, and this is the federal government example, like renovating a bathroom, installing railings and ramps to improve accessibility, adding additional play areas so that children would be separated, being able to, or improving those areas because they were deteriorating, fixing a roof. But construction of new facilities and major renovations are prohibited. So that means that you want to build a wing on, you can pay for the windows, the flooring, the new cabinets and things like that, but you can't pay for the construction. You can't pay for the hammer to nails and the building of that, your contractor. You can pay to replace 75% of your roof. If your roof was damaged and in need of repairs, you can't replace your full roof. So these are the kind of things that you have to be very careful to document and define. One of the other things, which is there's no childcare tuition may be paid for with ARPA-S funds. So you can't pay family child care tuition. But again, go back to the idea, you're offsetting some of your expenses, which probably allowed you to have some wiggle room with collecting tuitions or not having to do increases. This grant period is from January 1st, 2020 to September 30, 2023 is the time period you have to spend the money. CRRSA, you had to stop spending it September 30, 2022. This you could spend through 2023. Most of you have already spent your funds, but for those of you who haven't, hey, you still have time to reallocate. So let's go back. What about those income losses or other things that cost us money over 20 months? So again, this isn't for income losses, it's for expenses. And you're offsetting the income losses with recouping the operating expenses. So one of the things that we always try to point out is if somebody came to your house today and said, hey, Diane, we're going to pay all of your operating expenses. We're going to pay the mortgage, we're going to pay the cable bill, we're going to pay Eversource, etc. So that you don't have to take that money out of your income, past expenses or current expenses. And what would I do with that extra money? What would I do with that extra paycheck that I didn't have to put towards all of those expenses? That's the idea behind the ARPA stabilization. So as you think about where you're applying your funds for the allowable uses, really think about what stabilization means. It's having some of your bills paid for a few months. And what would that allow you to do with that freed up income? So when you think back about when you received your ARPA stabilization money, what did getting that infusion of cash allow you to do? Now, in some cases, yep, it covered the costs of increased prices. We all know that the cost of everything from toilet paper to electricity went up. In some cases, it allowed for staff wage increases or bonuses. But that extra money also might have helped you cover some of your family costs. Again, it's not the ARPA money that you're using for that, but it's the fact that you had your bills paid. Somebody might have paid the mortgage with the ARPA stabilization, and therefore that allowed whatever that mortgage amount was to go back in to be used for other things in your program. So think again how you might have used it and how did it help stabilize your operation? Because part of what you'll be answering is what was the impact? So what documentation will you need and how do you record it? You want to keep your sources for your application information, and you can go back and look at that application on your grant tile on NHCIS. And you just want to be able to say, okay, this is how I came up with those numbers. You do not need, and I will say this over and over, you do not need to align what you put in your operating budget in your application with how you spent your ARPA money, because you have the latitude to spend your money in any of the areas that we talked about. You want to keep that final award letter that's also in the NHCIS. You want to keep track of how you used your grant funds. So whatever you decide, you may have been deciding all along, you may be deciding now what you're going to put in each bucket of the ARPA allowable uses, and make sure that you document how you came to those numbers and the records related to those. Then you're going to log that info into the spreadsheet under the appropriate budget line item tab. And then it'll self-populate on that main finance page, and it's going to calculate out with each item. But remember that final report, when you think about our allowable uses as and expenses that we talk about today, you really want to make sure that you can, if you put in the rent, mortgage, and utilities line item, you got to make sure that if somebody says to you, well, now show me how you came up with that $2,000, you need to be able to document that. So let's talk about the budget line item headings that are going to be that fall under the allowable uses, but also you're going to be asked for in the final report. These are the list of the ones that the federal government, you probably recognize these from your quarterly reports. Now you're going to say, wait a minute, I've got things I don't know where they're going to go. So where's transportation go? And where does marketing go? Et cetera, et cetera. Where does overhead go? We'll talk about those, but these are the primary tabs, and there'll be some places where you're going to make a judgment call. I'll be able to see where you chose to put them. There isn't necessarily a right or a wrong, because it's about accountability as much as it is about making sure that you have included all of the costs. Ideally, when you get to the end of the process of documenting, the amount of money you received will equal the amount of money that you spent. And make sure that you really think about how far back do you want to go. Were there things, for example, that happened, you put in, let's say under that goods and services, that you put in the summer of 2020 that you might want to count as one of those allowable uses. So let's look at them individually, each one of these headings. And this is not an all-inclusive list, so I want you to keep that in mind. Now, this is not the 25% piece, although some of it can account for the 25% piece, but just general personnel costs. That's payroll, salaries, everything that goes with that, any premium pay or bonuses, the cost of recruitment, retention, any of those sort of things can fall under that, those personnel costs. That can be adding an employee, that can be just the regular staff that you had going in. Now, as an example, let's say you decide you're going to pay payroll, use part of it for payroll. And then what you would do is let's say you gave everybody a $2 an hour raise. Then you would put in your regular personnel costs the rate prior to the increase. So we'll grab a number and say everybody's making $14 an hour. So that would be what you would put in here, and all the related benefits and the taxes that go along with that. And then you would put for the 25% the $2 salary increase and the associated benefits and costs with that. So therefore you have met two requirements, or not met two requirements, but you've met the 25% requirement because you've started to add to that amount. as well as the fact that you can use it for the personnel costs. Now, in personnel costs, you can also put portions of other people's salaries. For example, let's say that you are part of a church and you pay for 25% of the bookkeeper. So you could put that in here as well. On the other hand, you might want to save that as an overall cost bundled together. Let's say you're in a organization, a Great Bay Kids or a Boys and Girls Club or a YMCA or something like that, where you have an overhead expense that you pay into a pot that then pays for a piece of the executive director and a piece of the building and so on and so forth. You might want to put that under the basic operating expenses. I would say with overhead, be mindful. You don't want to overdo the overhead so that it is disproportionate, so that when an auditor comes in and they say, we understand you needed to pay for overhead, but you disproportionately shorted the program and too much of the money, and not that there's particular parameters, but too much went to overhead. So what's next? The rent, mortgage, and utilities heading. Now, this is kind of an all-inclusive. You'll see it's everything from rent, additional landlord expenses under a lease agreement, could be your mortgage obligation, your utilities, that facility maintenance or improvements or insurance. Again, it's a little bit of a catch-all. This is sort of what I call your occupancy expenses. So related to being in a structure, staying in a structure, you would put if somebody had to redo a parking area because it was unsafe, and that fell in here. So that's the sort of thing that will fall under here. So don't be misled by the rent, mortgage, utilities. Think of it as occupancy. Next, you've got personal protective equipment. And this, I mean, we all know what this meant. A lot of that were masks and gloves and hand sanitizer and all of that sort of thing. But it also was additional things such as training and professional development related around health and safety. It was also that extra cleaning that you had them come in and do. And so just as an aside, I'll just show you an example. For example, under rent, mortgage, and utilities, you might have paid to replace the floor, took out the carpeting and put in tiling because it was much more sanitary. It was also something that needed to be done, but it also improved the health and safety. And then you decided to go ahead and hire a professional service to come in, and whether it's cleaning the carpets, cleaning the floors, doing some sanitizing, all of those sort of things would fall under here. Now, purchases of, this is a hard one to say, or updates to equipment and supplies. These were things that you did to respond to the COVID public health emergency. So this could be anything from you purchased, many of you did this, you purchased or created small kits for your kiddos of crayons and markers and all of those sort of things so that they weren't sharing. It could be anything from a thermometer to I'm trying to think, new vacuum cleaners. And it doesn't, when they say to respond to the COVID public health emergency, I mean, if you think about that, that is really general. So that is, there's a lot of things that you probably did. And ask yourself, as you're putting them in this category, did I purchase these things or update this equipment supplies to respond to the COVID-19 public health emergency, or should they go in your in the other category, which is goods and services? If you have any questions about those are great questions to put into our grant funding help desk link, which we'll talk about shortly. So you can put those questions in, and they'll end up also in the FAQs, so that if you have the question, I am sure your colleagues have the question. Now here's the catch-all. This is my favorite one. Goods and services necessary to maintain or resume childcare. services. This covers all sorts of things. So this is where I would put my marketing. This is where I would put my transportation. This is where I would put anything that I needed to run my program. So this is a nice catch-all. This is my kind of, if you can't figure out where else it goes, it will likely go here. Last but not least are the mental health supports. Now, we've got a lot of questions about the mental health supports. And I've had people say, well, I didn't send my staff for therapy, although I'm sure all of us need it by now. But mental health supports can be a whole host of things. Mental health supports can be everything from bringing in professionals to taking your staff for a or giving them a massage envy gift certificate, or providing yoga, or having a support group. I would consider, for example, a mental health support would be during that time when you were all shut down and you linked up your employees with your children via the computer. And that was not only supportive of the family and the children, but also of your staff. So again, think creatively. And if you have questions about what would count as a mental health support, the best way to answer the question is to go back and ask yourself, what were some of the areas where people needed support? Remember, in the early days, there was a lot of misinformation. There was a lot of stress. People were afraid to either bring their children to childcare. Some people had to go into work. Some people didn't. Was my income going to continue? Certainly, this also counts for those of you who are directors and owners. What kind of mental health supports did you need? Were these extra days off? Were these things where you had brought substitutes in whenever possible? And this also includes, again, the stress that continued to go forth with being short-staffed and the challenges of working in an environment where some bodies can be potentially ill. So there's a lot of stress related to that, the economic challenges that came for both families and children. So what did we do? What did you all do that we can link to an expense that helps support the improved mental health for our children and employees? And again, that includes you. So don't leave yourself out of this. Now let's just jump over for a minute and talk about the clarification of that 25% set aside. So remember that the 25% aside, 25% of the base award was for staff, what we refer to as incentives. It was for recruiting and retention. So you couldn't pay for staff childcare incentive, unfortunately, because that's considered direct care. But if you offset that with other expenses that allowed you to do that, you could use the CRISA money for that. But things like staff incentives would be wage increases, bonuses, gift cards. For example, we have a program that has been buying food and distributing because they're of the tax implications for their staff, and they were advised that if they did a weekly food purchase for the program and then gave away that food to the staff, that would be something that could count as an incentive. You can use, as we said, any or all of the remaining 75% for the base staff wages and benefits. But you do have to come up with 25%, and it doesn't just have to be in that personnel column. So again, if there's other things that you did that you feel, and you're going to be describing them, that can factor into recruiting and retention. Say it was a marketing campaign that specifically was designed to meet potential employees where they are. Perhaps it was a what I call recruiting swag, that you took to events to meet people. Maybe it was things that you purchased for your staff, that were you gave them each a $200 or $300 towards purchases of items for their classroom. You can count a portion of that. But as you think about it, obviously you think about the tax implications, but you also want to think about equity. It doesn't have to be, everything doesn't have to be the same, but also think about the optics. And did you actually, if you're saying that you gave your staff bonuses or you gave your staff increases, again, it's the portion of that increase or the bonus that counts towards the 25%. Did you actually do that, and can you document it? And understand that the implications for not meeting the requirements are, it is a requirement, so you will have to go back and shift funds. If we get a report and it doesn't show that it was 25% was utilized, we'll come back to you and say, sorry, you have got to justify it. And know the difference between paying for something and giving an incentive. It's towards something. So again, if you are giving an incentive, it is to promote a behavior to support a positive outcome, to reward somebody for a job well done. Those are all, and to have people to come to work for you and to stay working for you. So as you get into this 25%, if you feel like you're in trouble, and reach out again through that help desk link, we'll help you be creative, innovative, and we'll think of how you can customize it. There's been some really cool things that people have done. And again, that set aside, it from the, if you look at what the Fed refers to as under the personnel costs, which are right here, increases in compensation, vision insurance, scholarships, paid sick leave, all of those sort of things, all piece of those can all count towards that 25%. And then of course the staff development piece, that you've got two places you can put that. Now, one of the things I really want to emphasize is make sure that you're not putting things in two categories. So for example, if you put staff development someplace else in a good and service, then make sure that you didn't put it under personnel expenses as well. So just make sure that you put it in different place. But if you have, for example, under the goods and services, or the staff or the mental health, there's a great one. If you have stuff under the mental health, and you have $10,000 under the mental health, and then there will be a place on your spreadsheet where you'll say, well, of that $10,000, X number of dollars of it counted towards my 25% staff set aside. Just make sure that you don't again count those same services under the personnel costs, because number one, it won't add up, and number two, it won't make sense to it won't meet the criteria. So I just threw in some of those staff recruit retention ideas, some of the things that you could use for that set aside. Whatever the hot button was for certain staff, straight bonuses, which were, obviously hoping people got those increases, temporary or permanent wage increases, which some of you did, education, self-care, family perks, benefits, paid absenteeism, extra vacation days. I do want to go back and say, make sure that in any of these things, any of the categories that we talked about, that you aren't double dipping. So in other words, you are not saying, for example, I'm trying to think of an example. We paid staff wages, but you actually got, what is it? PPP, I think is what it was called, money for, and did not have to repay it for those staff wages. So again, make sure that it's a real clean line, that what you did with CRISA money, what you did with the ARPA money. And then again, if you're part of that CCDF discretionary quality incentive, and what you did with that money, because they do overlap. So last but not least, what technical assistance is available? So as you're trying to figure out those allowable uses, you can go to that new page that we created on New Hampshire Connections, and you'll see that each of the grant programs have their own little listing. They'll have their webinars. Eventually they'll have their FAQs, which we're developing out of the webinars, as well as what people are asking through the help desk. There's a link on the page to the help desk. There's also the informational memo that we developed. I just updated it today. I don't know if they have it posted yet, but we're getting there. So it'll say 12/28 on it, and it has some new dates and some new information. There'll be the allowable uses chart. And the biggest thing I want to emphasize is, and this webinar will be available, is please don't hesitate. Ask as many questions using that help desk line as you want to, because we're happy to answer them. It's the quickest way. I'm going to sit down today and play catch up for the ones that I missed since the holiday. But it is a great opportunity for you to be able to get a lot of information. The good news is you don't have to wait in terms of assistance and resources for copies of your application if you want it, or your agreement, or your invoices, or any of those things, because they're all available through your NHCIS grant tile. I am working and have gotten through probably 30%, and with the help of a colleague, of the financial summaries. So those are coming out. If you didn't hear that in our previous conversations, you're going to get an email that will include a breakdown of what you got for CRISA, what you got for ARPA, what you got for CCDF discretionary quality incentive. And if you happen to get NHEYP, which, don't panic if you're like, what is NHEYP? How did I miss it? It's for middle school and high school kiddos. So probably didn't apply to most of this audience. And also know that our colleagues over at Child Care Aware, ENLH, lots of the childcare networks, the regional leads, everybody's pretty well versed in this, and they are happy to step up and help you. Again, if the question is, what category does this go into, or is this an allowable use? The best thing to do is put that into a question after you look at the resource materials, and go forth from there. And as we always say, don't hesitate to ask for help. Just bear in mind that the email boxes are inundated, so please stick to that grant report help desk link. So that covers anything and everything I can possibly say as quickly as possible. So what I will do right now is we will jump over to questions. Why don't we go ahead and stop our recording?